Hello and welcome to our Facebook Live, or if you're watching this later on YouTube or Twitter, hello to you too. We're currently here looking at the smells of Christmas, and that's not just the Lynx Africa that your nan brought you as a Christmas present. So we're here with two of our academics. Do you want to introduce yourself?
Okay, I'm Neil Grazier, I'm a technician in pharmacy.
And I'm Matthew Stibbs, I'm one of the teaching fellows and also the admissions tutor for pharmacy as well.
Fantastic, and you have brought lots of props today. This is going to be really exciting. So what we're going to do is we're going to look at some of the smells of Christmas. So Matthew, do you want to give us a quick background into those smells and why we feel Christmassy with certain smells?
Okay, so when you think about Christmas, you do get the idea of different sort of sounds. So the Christmas carols, maybe some of the Christmas songs that we hear every single year. You've also got the different sights that you're used to. What we wanted to have a look at, though, was having a look at the smells that are associated with Christmas. One of the things that we might not know so well is that different things that we associate with Christmas do have medicinal uses as well. So, you know, in our sort of area of practice being pharmacy, it's actually quite useful to know the background to some of the things that we're actually using in medicine. So we thought that this would be a great aspect to have a look at.
Fantastic. Anything to add?
Okay, what I'll be talking about is how the shapes of molecules can affect the smell, and how that can be related to how a drug molecule can actually interact with the surface of a cell.
Great. And so we're going to use me as a subject. I'm going to be smelling some... the bottles are labelled, but I don't really understand anything that's written on them, so I'm going to be guessing what I smell and just trying to describe it as best as possible to you. And hopefully you'll be able to think and imagine some of these smells as well. So shall we start with our first smell?
Yeah.
Okay. And this is labelled up Wintergreen.
Wintergreen. Okay.
And this is an essential oil. And
it smells a bit like... it smells very medical.
Yeah, that's fine, because it actually contains an awful lot of salicylic acid.
Yeah.
And what we can do with what we do with schools sometimes is actually extract the salicylic acid from that essential oil, and we get them to isolate that as a nice crystalline form.
It's a little bit minty.
Yeah.
Is that right?
What it will have is a lot of terpenes in there, and those will smell quite piney as well. So you should be getting quite a medical smell with a bit of pine on top of that.
Yeah.
But that's how we've used it in the departments, is to use this for schools' workshops, and they get to do quite a nice extraction process from a natural product.
So this is almost your pine, is it your Christmas tree?
No, it's not really the pine. If you wanted pine, we've got something which is a little bit nearer to pine, which is terpenol, and you'll probably find that is very much more pine.
Oh yes, yeah. That's your Christmas tree, is breaking
That's
those.
Absolutely right. And a lot of these kind of molecules, especially the pine molecules, they don't react in very aggressive chemical environments, so they tend to be used a lot in toilet cleaners and antiseptics. So sometimes when you do smell these, your immediately thought will be, oh, that just smelled like Harpic.
Yeah, no, exactly. That's what I was getting. This, it's very, very strong, very almost not like bleachy sort of smell.
Yeah.
That stuff I would clean my toilet with.
Yeah, I'm afraid it does smell like that, and it is literally the active agent that goes into these toilet cleaners, not to clean the toilet, but to give it a fragrance.
Right. Okay.
Because nobody wants to smell a toilet. You'd sooner smell something minty or fresh or outdoors.
Yeah.
Okay.
Brilliant.
Let's get off the toilet subject.
Yeah, so with the wintergreen that we've had a look at, with having salicylic acid in there, that tends to be the basis of drugs such as aspirin. There's other different drugs that we can use that have anti-inflammatory properties as well. They would be derived from salicylic acid. So, you know, one of these smells that you've just gone through with the wintergreen actually does have a really important use in medicine. So aspirin, you can use it to keep your temperature down. If you've got any aches and pains, you can use it to relieve the pain. And then also it's used for blood thinning as well. So if you've got things like if you're at risk of having a stroke or a heart attack, they tend to give you aspirin just to help keep the blood thin, just to keep everything flowing for you.
Right.
And then when we're having a look at the pine as well, you might have heard of something called Tamiflu. couple of years ago when we had the big flu outbreaks.
Yeah.
There was quite a shortage of getting hold of Tamiflu. But actually, Tamiflu's been based on extracts from the pine needles themselves.
I see. Oh, okay. Brilliant.
So your Christmas tree does have all the uses.
Yeah.
On the side of just looking pretty every year.
Oh, okay. Amazing. What's our next smell then?
Okay, I think what we'll do is give you a smell of, well, let's see if you can tell the difference between these particular two.
Okay.
Okay, we'll give you
This one first.
our version first and see if you...
Oh, it's all right.
Okay.
Not smell anything.
Okay.
Okay, so it's quite, I'm smelling orangey.
Okay, that's
Yeah.
really good.
Really quite a strong orange smell in there.
Yeah,
a
that's
nice
brilliant.
orange that I found in my Christmas stocking.
Okay.
One of those.
And, okay, would you like to smell this?
Sure.
Okay.
So this is a lot more acidic. It's like it's a bit minty. Yeah, it's a bit spearmint. Is that right?
No, it's meant to smell of lemon, so...
It's a bit citrusy. Now you've said it, but it's a lot stronger than that. It's a lot more harsh on the nose than that.
Right, okay.
Yeah. I was close.
Don't worry.
We were laughing at
People
my
do
smell.
often smell things quite differently. It's quite common. Okay, but the reason I put those two together is because the actual molecules that we have that those two are based upon are very closely related. In fact, how I've laid them out here, you should see them as almost mirror images of one another.
Yeah.
Okay. And you might think that these would be almost, in many ways, they are almost chemically identical. However, how they interact in the nose is quite different because the nose, in terms of how it interprets smell, uses a mechanism with the G protein on the cell surface. And that's very similar to how salbutamol acts on the cell surface in the respiratory region of the lungs. And it's only one optical isomer, which is one of these two molecules, which will actually activate a particular receptor. So what you have is, we had one molecule which was great at smelling like oranges, and this was the one that you couldn't actually smell particularly well, which was meant to be the lemon smell, but never mind.
But these are very similar.
That's the whole
shape.
point. They're incredibly similar in shape, but they are literally a mirror image of one another.
And they were completely polar opposite in terms of how they smelt. One
That's
was
right.
One was a very warm smell, and one was quite a, like I say, almost tickled the hairs on my nose as it went through.
And this is really what we're trying to say, is there is quite often when a drug is manufactured, salbutamol is a great example. One form is actually active and actually makes people better.
Mm-hmm.
The other is totally useless.
Oh, okay.
So half the drug I'm inhaling, because I'm asthmatic, is actually going to be ineffective, whereas half of it is actually effective, which in the case of salbutamol, those two optical isomers don't create a great deal of problem. However, they can create really big problems if you get a preference in of one to another. So if you have an awful lot of one isomer and you can't control that when you're manufacturing, that can create a problem because you may not be able to make the correct material. And you also have the story of I can't remember. Thalidomide. Yep. I'm sorry about the gap there. Thalidomide during the 1960s, where one optical isomer really caused big problems, whereas the other one actually worked perfectly nicely. But unfortunately, the manufacturers didn't separate those two isomers out.
Right.
And so talking about smell is a nice way of demonstrating the body does have a very specific route of actually analysing these molecules, even though they look almost identically shaped to us at first glance. We actually we're very, very discriminating in our smell sense.
Yeah.
And we've got another example of that if you want to have a look at, and we've got two other optical isomers, and we've got this one here.
Okay.
Do you want to smell that?
So that's it smells like your Wrigley's extra chewing gum.
That's exactly right.
Spearmint.
Spearmint, yeah.
Familiar smell.
That's right. And we've got this, which is Carvone, and
Oh, it's hot. It's a stronger smell.
mhm.
It's a bit. It's hard to describe. It's like it's a little bit minty,
yeah,
but it's not as nice as the spearmint.
yeah. I mean, to be honest, I prefer the spearmint myself in terms of the smell, but this often goes into cakes and food mixes as well.
Really?
Yeah. I take it you didn't enjoy the smell.
No.
I mean, no, that smell is incredibly personal. You know, you can have. It's part of your genetic makeup as to what you actually pick up. So there will be some smells that you pick
Smell
up that
that
I
again.
don't.
This is in cakes and.
It can go into cakes, yes.
Oh God, it's. I just can't imagine it in a cake. How weird.
Well, it would normally go in as a seed form,
Right.
And it would be wetted out. And,
It wouldn't be as powerful.
it wouldn't be as powerful as that, but that is the pure form. And what we've got here is the apparatus for extracting that particular form
Okay.
from the seeds, because that's part of our undergraduate process, and that's part of one of the labs that we do with our first year students in the first few weeks to show how a natural product actually can generate a very pure product. And we've got one of the oldest chemical processes in existence here, and that's steam distillation. And that's very simple.
Yeah, talk us through this.
Basically, what the undergraduates would do is put an awful lot of water into this flask.
Yep.
They'd half fill that, and they'd put in their 25 grams of seeds. They'd boil that up, and what they'll get across is an awful lot of water, but within there, there'll be an oil that floats on the top. And that oil is what we call an essential oil. So the Wintergreen is generated by a similar process. And this process has been used for hundreds of years. And it's how you get lavender oil out of lavender, how you get rose oil out. There's an awful lot of perfume components that are extracted via this process.
And this is still the best, most efficient way of doing it. It's the way that
It's the way
just
that
on a
it's
bigger
done.
scale.
It's done on huge scales. Norfolk, you see fields and fields of lavender, and they'll go into exactly the same sort of process, only on a grander scale.
Yeah. Wow. And this is what the undergraduates do
Yes.
as,
Yes.
as a nice little practical.
Yes.
Can you get a smell from these? Are these?
Yeah, you should be able to get a smell, but
Oh, that's much nicer.
right. Okay. That is the seeds, and that's what you'd be putting into a cake.
Right.
What I put under your nose earlier was the purified
Pure.
product.
Yeah. Very strong.
And yeah, you would expect that to be much stronger. So, and one of the things that we do see with this is that people do like to. They are very tempted to give this all a smell when they're in the labs, and of course we're trying to discourage that, because what we don't want people doing is putting their heads into fume cupboards, because that's exactly what we want them not to do. So we do sort of say, smell the seeds, try not to smell the finished product.
Yeah. Great. What else? Have we got anything else?
Well, what I've got here is some of those products that are actually dissolved up in ethanol. Now, the reason I dissolved them up in ethanol was because this is traditionally what perfumers have done. They've got 1% solution in ethanol. Now, if you actually smell them, you will probably be overpowered by the smell of the alcohol.
Right.
Now, traditionally, what people would do is put that on their skin or on the clothes, and the alcohol would evaporate and leave the smell behind. Now, I don't recommend that because these have got quite substantial hazard ratings on them in terms of leaving them on your skin. So, and they're also the limonene molecules actually have an allergenic profile as well, so we definitely don't want those going on your skin. But
Right.
have a look.
Let's have a smell.
Yeah, have a smell.
Let's see if we can guess these. So again, it's a bit minty, this one. It still smells a bit spearminty.
Yeah, that is absolutely right. That is the
Spearmint.
spearmint. Yeah, that's just in 1% in alcohol. So
Yeah.
that's so if you wanted to smell like Wrigley's spearmint gum, that would be what you'd wash yourself down in. Only you
take
wouldn't
that with
because only you wouldn't do for safety reasons.
This one's a bit a fresh smell.
Okay, and that was our lemon.
It smells nice and it's fresh. Nice and fresh. It's a bit. I don't know whether it's just this wet wipe, but it reminded me of almost a wet wipe smell.
Right. Okay. That I think is
So it's like
the
the
limonene.
lemon.
So that will be the lemon.
Yeah, a bit of lemon
so,
in there.
Okay, and
So I got lemon that time.
okay, great. Okay, and this was the carvone smell. So see if that matches up with the seeds again.
Okay. Yeah. Yeah.
Okay, that matches with the seeds.
Has this got a higher alcohol concentration than the other one, or did it?
No,
exactly the same?
they're meant to be the same, but
Maybe I'm just getting used to it.
yeah, you're not going to be drunk by the time you finish smelling these. It's really very difficult to inhale that much alcohol and
No, it's
get you
great.
drunk.
You can really smell the different smells though in it. Like I say, this feeling of warmth and cold smells is really interesting. What is that? Just my remembrance of the
That's
certain
just your
smells and certain-
perception. Perfumers will actually organise smells into sort of groupings, and they will have like a citrus grouping, and you might view that as warm, or and they'll have a woody group of smells, which are sometimes things like oak moss extract and things like that. So they will cedar wood, these kind of things. So the idea of what you're doing there, of sort of trying to form a memory map to a smell. Well, it's known as Proust moments, because Proust writes about smelling bread in his kitchen and going back to his childhood.
Right.
So these are all well-known aspects to smell.
I see, and we're
So
just setting off feelings inside you that makes
Yeah.
you think. And again, with the Christmassy smells, I know you've got some examples there, haven't you, Matthew, of different types of ones.
Yeah.
They just immediately make us think of this time of year and almost a warm, cosy feeling. A lot of them, I'm guessing.
Yeah, and there's a historical past to it as well. So with the oranges and the lemons, they're commonly used as fragrances, and they're also used in medicines as flavouring. So quite a lot of tablets now, if you have the chewable forms, will be lemon flavoured.
Yes.
Orange is used in penicillin suspensions as well. So if you've ever had a bit of a throat infection, they might have given you the liquid form. You get the orange taste to it. So they'll use them for flavouring purposes. But sort of going back historical, so like to Victorian times, the oranges and lemons were used to try and sort of disguise the fragrance coming from the drains and the sewage outside.
Mm-hmm.
So that's kind of been associated with that. But at Christmas, people had more oranges given as gifts and lemons. So you get that kind of tie in between the two. One of the ones we didn't show you today was cloves.
Mm.
So quite a lot of the times the oranges used to have cloves inserted into them, so you might have seen I haven't got an image unfortunately to show you, but like the orange with the different pieces of cloves throughout it, so it forms a nice little festive pattern or shapes with it. So that's what was known as a pomander. So that again, that was given to people to help take away the smell of the sewerage, so they could walk around with it.
I see.
So that's kind of the historical sense to it. But the clove oil itself is actually quite useful in medicine in terms of treating toothaches. So if you've ever had a really bad toothache, you can take things like paracetamol. It will take some of the pain away. But actually, if you use clove oil, it does have sort of anti-inflammatory properties. So you can just apply a little bit of that to the gum, and that will help to treat the toothache. So you kind of do get that tie-in between the smells that you've got, and the reasons why you're associating them with Christmas is because you've seen them more frequently at that time of year. But it does have that historical element to it as well.
Brilliant. And just before we wrap up, let's have your favourite Christmas smell.
Ooh, that's a good one. I probably would go for orange, actually.
Orange?
Yeah.
I think it's got to be a pine Christmas tree.
Yeah, the that woodiness, is it?
Yeah.
And the sort of almost minty. Brilliant. Well, thank you very much for watching. It's been a pleasure. And let us know what your favourite Christmas smell is. And we'll be doing a couple more of these, so keep an eye out on our Facebook and YouTube pages, and we'll see you on the next one.
Thank you very much.